Here we go. Hello, and thank you for watching this webinar on nurse practitioner, billing, coding, and documentation. There's no audio taping or videotaping allowed, in any unauthorized reproduction, dispensing, forwarding, or copying of this target coding presentation is illegal. This presentation is for educational purposes. It's not intended to be legal advice. If you need an attorney, go get one. We don't provide legal services. I've made every attempt to make sure the information in this presentation is 100% accurate. However, it's not guaranteed. All right, let me tell you a little bit about myself before we get started. For those of you that do not know who I am, my name is Dr. Marty Kotler. I am a chiropractor. I practiced for many years. I practiced for 16 years. 12 out of the 16 were chiro only. 4 years were integrated. After I became integrated, I started writing articles to Chiropractic Economics on how to bill and code and document in an integrated practice. And all the services we did in my integrated practice were all holistic. No medications, no foreign substances. Even if we did trigger point injections, they were with Traumeal, a homeopathic remedy. So everything was completely natural. That's the way we did it. Most integrated practices use some prescription medications, but that's fine. But we were all holistic. So I started writing articles to Chiropractic Economics on how to bill and code. And then I started getting calls from chiropractors all over the country asking me for advice. So I went, hey, I'm going to start a consulting service part-time, and then it grew to full-time. I also became certified in billing and coding. I'm also a certified professional compliance officer. I continue to write articles to Chiropractic Economics, Dynamic Chiropractic, the American Chiropractor, the American Academy of Professional Coders. I write articles for many state association newsletters. I've written many books and created videos on chiropractic billing, coding, documentation, also for physical therapists and acupuncturists. I'm a guest speaker at many state association conventions nationwide. Target Coding puts on seminars all over the country. We also offer consulting services, webinars, books, training videos. We have a CA boot camp. We've been around a while. We've been doing a lot of stuff, a lot of good stuff. So that's a little bit about myself. Now, bringing on a nurse practitioner. It's not all, a rosy picture that maybe some other organizations have painted. I know there are some practice integration consultants that if you don't integrate your practice and you stay chiro only, that's not going to work for them. They won't take you on as a client. So in the way I look at it is, if you're chiro only, we could help you. If you're integrated, we could help you. So it doesn't matter to us. That's why we like to share some of the negative things about bringing on a nurse practitioner. Just so you're aware, why should you get caught by surprise? Find out now. I'm going to be sharing the things that were not so smooth and easy when I brought on nurse practitioners and other healthcare professionals. But let me just tell you, overall, it's a great way to co-treat patients. There's more negatives than positives. So just want to let you know, I think it's a great way to co-treat patients. I think it adds another clinical approach to the practice. When I had my medical professionals in the office and I was dealing with a patient that I just didn't think was getting better, they were just, plateauing. I speak to the other healthcare professionals and I learned so much dealing with them. You're definitely going to add more services. See, what I wanted to do, there were some invasive services I wanted to do in my practice, like intravenous vitamin and mineral therapy and chelation therapy. I'm not allowed to do that as a chiropractor. It's not within my scope. So I had to add more services to my practice. That definitely added more marketing opportunities. I got a lot more new patients coming in because I had more services being provided. So those are a lot of the positives. The negatives, you might not have enough room. Working with a chiropractor right now, he has 500 square feet. That's all he has. He cannot bring on another healthcare professional. It's just too small. Malpractice costs, overhead. How much you want to pay the nurse practitioner? I'm going to go over salaries. You might not be able to afford a nurse practitioner. They may be hard to find. I'm working with one doctor in Missouri. 2 years he's been trying to find a nurse practitioner. And if you find a really, really good nurse practitioner and then after a few months they quit for whatever reason, which happened to me quite a few times, the turnover could be stressful. So if you're chiro only right now and you're thinking about bringing on a nurse practitioner, a nurse practitioner can do just about anything a medical doctor can do, from treating diabetes to high blood pressure to congestive heart failure to skin problems, dermatology. A nurse practitioner may have been working in a gynecologist's office, and now you're bringing on a nurse practitioner. What do you want them to do? You have to think about the services you want to provide. What's your ideal practice setting? Most chiropractors that go to a integrated practice model, they transition and they stay within the pain management model. That's fine. I did it. I went into weight loss and cellular reduction and chelation therapy and joint injections, So it was a little different than most chiropractors do right now. So think about, what do you want to do? You want to do Botox? You want to do stem cell? You want to do PRP? Like, what do you want? What's your ideal practice setting? The doctors that go, oh, my chiropractic practice is like a little stale. I want to grow. I want to bring in more money. Okay, think about, what services do you want to provide? I'm going to be sharing a whole bunch with you today. So the setup, make sure you get a good attorney. We don't provide legal services. Again, this is not intended to be legal advice. You need to get an attorney. Even if you have an existing nurse practitioner in your practice, speak to an attorney. Make sure you have all your corporate papers set up properly. And there's a few different choices. You have employer-employee, partnership, or you could rent space to a nurse practitioner. So if you're the employer, you're the boss, you're now going to employ a nurse practitioner. Fantastic. So you're going to do all the billing under your tax ID. You're going to pay the nurse practitioner and probably a medical doctor as the collaborative MD a salary, a straight salary. You're going to receive all the gross revenues, less the MD and NP salaries. Get an attorney that knows how to create a comprehensive employment agreement that specifies what's the deal with non-compete, non-solicitation, confidentiality. Do you want your nurse practitioner moonlighting a couple of days a week in another chiropractor's office down the street from you? Are you okay with that? These are the things you want to outline. Now, some of my clients have gone partners. They've actually partnered with a nurse practitioner and a medical doctor. So if that's the case, all the billing goes out under the group tax ID. The shareholders or partners receive compensation attributable to the ownership in the business. So if you own 70%, you should be getting 70%. Check with your attorney, because those arrangements have a lot of flexibility. I've learned over the years, dealing with a lot of attorneys, I've learned a lot of good legal advice. And guess what? I can give my clients a little bit of that information, free legal advice, so to speak, from what I've learned. Um, just like the attorneys I work with, I educate them on proper billing and coding, and they are allowed to share some coding information, but I'm very careful not to give out legal advice. Okay, so if you're going to have a partnership, get an attorney to create a comprehensive operating partnership agreement. How is the money going to get dispersed? Confidentiality, stability, termination, very important things. You need a good lawyer. Now, you also may need to form a management company. The management company provides services to the medical corporation, like marketing, staff management, housekeeping. That's where I had a management company and a medical corporation, and the medical corporation paid fees to the management company to help run the practice. Now, last scenario, not that common. If you want to rent space to a nurse practitioner, you can do that. So the nurse practitioner will do his or her own billing under his or her own tax ID, and you get a straight, flat rental every month. Here again, you need an attorney to create a sublease agreement which specifies, do you want the nurse practitioner to use your fax machine and your computers and your staff to do the billing, or are they going to bring in their own staff? It should specify the equipment. It should be at least 1 year in duration. The rent is set in advance. It's not based on patient referrals or patient volume. That could be a violation of the anti-kickback statute if you're getting paid per patient. Careful with that. Now, who can provide services in your practice? Well, the AMA breaks it down into two categories: qualified healthcare professionals like chiropractors and nurse practitioners, and then we have clinical staff. like rehab techs and certified athletic trainers. Clinical staff can't bill insurance. QHPs can. That's the big difference. So now let's get a little bit more specific about nurse practitioners. They can initiate care plans and recommend services and procedures. They can supervise and administer common procedures such as mechanical traction, ultrasound, and therapeutic exercises. Nurse practitioners must complete a master's or doctoral degree. There's a couple of other degrees out there. Well, first of all, you have just an RN, a registered nurse. Then you have licensed practical nurses. There's a degree called a Doctor of Nurse Practicing. There's all these different types of nurse degrees leading up to a nurse practitioner. So it's an advanced clinical training beyond their regular nursing degree. There are about 100, well, there are about 325 colleges and universities that have nurse practitioner programs. There are approximately 270,000 nurse practitioners in the United States, 200,000 physical therapists, 65,000 PTAs, about 70,000 chiropractors in the country, and there are about 1 million medical doctors in the United States. Yeah, over 1 million medical doctors in the United States. Now, nurse practitioners' average salary, according to my research, is about $80,000 a year. They're licensed in all 50 states. Now, the rules can be complex on nurse practitioner services. They can vary greatly from state to state. In some states, nurse practitioners don't need to have a medical doctor involved. So you want to check with the state board on the types of qualified healthcare professionals and clinical staff members you can employ. Check with all the health plans on the supervision requirements prior to billing. Inquire as to who needs to be on premises when the procedures are billed and performed. Those are the things, we do for our clients. If you're not a client, please go ahead and take those recommendations seriously. And yeah, there's some great sites that you can look up to see, does the nurse practitioner have full practice scope? Is it restricted, reduced? So this is a great website. It's the American Association of Nurse Practitioners. It breaks down the states into which can have full practice, reduced practice, restricted practice. Now, how do you find nurse practitioners? I always ask, whenever I needed anything, I asked my patients. If I was looking for a physical therapist, I asked my patients. If I was looking for a car, I asked my patients. If I was looking for an electrician, I asked my patients. They were the best resource. But you could contact local schools, job placement sites, Indeed.com, ZipRecruiter. I even had some of my clients find nurse practitioners on Craigslist. If you're going to run an ad, put stuff in like, hey, great position to work in a state-of-the-art facility. We emphasize high-quality care. You're just talking to a nurse practitioner. Maybe you're working out in the gym and you're talking to someone and they tell you, hey, I'm a nurse practitioner. These are the questions we get here all the time at Target Coding. Our client is a chiropractor. Hey, I go to the gym. I'm always working out next to this orthopedist, and we always say, hey, we're going to work together, or a nutritionist, or a massage therapist, or a nurse practitioner. Hey, we should work together. What questions do you ask? What do you say? How much you want to pay the nurse practitioner, right? These are the things if you are, new to this, you probably have no idea how much to pay a nurse practitioner, part-time, full-time. Should I offer health insurance? How do I train the nurse practitioner? It could be overwhelming. I remember bringing on healthcare professionals. I had no idea how to tell them what to do. I had a medical doctor come in. I'm going to teach this medical doctor how to do injections. The medical doctor should be teaching me, so you want to make sure they know what they're doing. Have them send your resume, so you want to interview a ton of them before you hire one. Now, here's a question that we get. Why would a nurse practitioner or medical doctor want to work for a chiropractor? Right? Why don't they run their own practice? Why do they need us? Right? You ever wonder why? Well, they might not want to run their own business. They just want to show up at 9 o'clock and leave at 5 o'clock, right? I'm sure many of you that work 70, 80 hours a week, you think, oh, I'd like to work from 9 to 5 and have no stress. Well, you're the business owner. You're going to have stress. You're working 80 hours a week. The nurse practitioner may only want to work, maybe 4 hours a day. I was looking for a physical therapist. One of my patients said, "Hey, I have a friend. She's available, but only like 6 hours a week. I hired her. She only needed a few hours." They might not like the hospital setting. They want a guaranteed income. That's another thing. A lot of docs, I want to get paid every week, regardless if I see a patient, don't see a patient, if Aetna or Cigna pays or don't pay, I want to get my salary, my guaranteed income. Yeah. Now, once you find one, or while you're going through the interview process, make sure you find an MD and an NP that's chiro friendly. Explain to them how you typically manage a case. Let them know what they're going to be responsible for. Here's just a list of duties and responsibilities. You're going to be responsible. Tell them right up front. Why wait for you to go through all of the interview process, the credentialing, bring them on board, and then tell them what they need to do? It might intimidate them. They might quit. Tell them right up front. Look, nurse practitioner, you're going to be responsible for evaluation, planning, directing, and administering treatments in order to produce effective outcomes. You're going to be responsible for coordinating, delegating, and supervising responsibilities, commuting, and assisting in resolving problems. You need to participate in our training. You need to understand and comply with the office billing and coding policies and procedures. If we do orthotics or back braces or DME or simple therapeutic exercises, you need to know the clinical rationale and how to administer those things. Next, credentialing. Do you want your nurse practitioner in network or out of network? Out of network, it's simple. In network, you may have to fill out some applications, contact the existing plans, let them know. It's another thing we do for our clients. We do offer an MD, DC, PT, acupuncture consulting program. And what we do is we help the doctor with the credentialing process. It saves so much time when we get involved. Just let us do the credentialing for you for Medicare and for CAQH. We don't do regular insurance, but we can get your nurse practitioner a Medicare number enrolled in like probably 3 weeks. You want to contact the plans, let them know what's happening, that you're going to have another healthcare professional. And you should know the ins and outs of in-network versus out-of-network. You should know the pros and cons. You're going to have your nurse practitioner in-network. The fees are going to be different. You're going to have to go through credentialing and then contracting. Out of network, the fees are going to be different. There's a deductible that you have to get past. So I'm not telling you to have your nurse practitioner join any plan. I'm not telling you to have your nurse practitioner drop out of any plan. That's a business decision that you need to make. There's pros and cons to both. All right, let's talk about a brand new patient. A brand new patient is going to come in and going to see your nurse practitioner. Let's go through a little patient flow here. Patients need to fill out forms. Make sure you have good quality forms that address all these things. Review of systems, financial policy, informed consent, HIPAA forms, and OIG, your billing and coding forms, your staff training forms. Once you go, see, I have some clients that are small mom and pop chiropractic practices. They make maybe, $100,000 a year. Maybe they see 75 to 100 visits a week. To have a compliance plan, billing and coding formal policies and procedures, it's not as important. And I'm telling you from a certified compliance officer, every office should have billing and coding policies and procedures on a HIPAA program. But if you're a small practice, it's not as important. I'm not saying it isn't important, but if you are like, I have one client, he makes $25 million a year. He has 14 practices. He's doing very well. He has a full-blown billing and coding policy and procedure manual for every office and a complete HIPAA program for every office. Why? He has more to lose. He could lose millions of dollars if he doesn't do things right, whereby a small practice might be able to get away with losing maybe $50,000. So make sure you get your employees trained. I mean, if you have ever worked for a corporation, like a large corporation, like IBM or maybe a vacation company or Starbucks, when somebody comes on board, they go through a full, complete training on policies and procedures and making sure they sign all forms that they understand that if they don't do things right, they could be fired immediately. So these are all the forms you want to get through. Make sure you have a good HIPAA form. We have a really good form. If you want our HIPAA form, send an email to natasha@targetcoding.com. That's NATASHA at targetcoding.com, and she'll send you our HIPAA form. This is a really good form. It asks, can we confirm your appointments by email, text, or phone? Can we leave a message on your machine? A little bit more about patient flow. So a brand new patient comes into your facility. You have an MD, you have a nurse practitioner, you have a chiropractor. Who's going to see the patient first? I would recommend, well, if the MD is not on site, which the MD doesn't have to be there full time in most practices, the nurse practitioner does the history, the exam, does decision making, establishes the diagnosis, and creates a plan of care. The nurse practitioner is probably going to recommend chiropractic, may recommend trigger point injections, large joint injections, nutritional consultations, DME. Who's going to reevaluate the patient on an ongoing basis? It has to be the nurse practitioner. The nurse practitioner is the quarterback in this case. Nurse practitioner is the quarterback that will be throwing out the passes to all the other healthcare professionals. So here are some of the services that your nurse practitioner is going to be delivering. Evaluation and management services for new and established patients, right? So your exams, your re-exams. I've trained many, many nurse practitioners over the years. I can tell you most of them, when they come on board into a chiropractic practice, they do not know how to document a 99203, which those of you listening to this, you should know what that is. They don't know how to document a 99203. They've never been trained. They just do their thing, and they may have been working in a hospital setting. Nurse practitioners don't take courses on billing and coding. They don't know what's required, but you need to know because you're the boss, you're the employer, you're in charge of the billing and coding. So you want to teach your nurse practitioners how to do a consultation to justify the code. So if you're billing 99203, the nurse practitioner must document at least one chief complaint, 4 HPIs, 2 to 9 systems, and 1 item from the PFSH. Now your nurse practitioner is going to do an exam, going to bill 203. Does the nurse practitioner know what the bullet points are? Need 12 points, 12 exam findings. It all comes from the E&M guidelines, these bullet points. Your nurse practitioner needs to know these things. Now, if your nurse practitioner is going to be recommending modalities, supervised modalities, make sure the nurse practitioner knows supervised modalities is the application of a modality that does not require direct one-on-one contact. It's not time-based, one or more areas. Nurse practitioner is going to oversee, and the claims are going to go out with 97012 or G0283. The nurse practitioner needs to know about these modalities. They're not difficult to learn. Have the nurse practitioner take a little course on modalities. They could even watch my videos. And then we have constant attendance modalities. Does your nurse practitioner know the difference between attended stim and unattended stim? Ultrasound, does your nurse practitioner, if your nurse practitioner is recommending ultrasound, do they know what the purpose of it is? That's all in my book. I have a book on the best CPT ICD-10 codes to maximize reimbursement. I give you the clinical rationale for all of these codes. Make sure your nurse practitioner knows why. Not, okay, every patient that comes in is going to get stim, is going to get exercises. On visit 2, we do DME. On visit 3, we do an NCV. On visit 4, we do range of motion. Those days are over. If you're practicing like that, you're practicing like it's 1995. Can't do that anymore. If you're going to have the nurse practitioner recommend laser, okay, what are the codes? What are the documentation requirements? Therapeutic procedures, yeah, very common. Nurse practitioner sees patient. Nurse practitioner recommends therapeutic exercises. Okay, does the nurse practitioner know that this is a therapeutic procedure which requires the application of clinical skills to improve function? See, your nurse practitioner, although they may feel like, hey, I just show up at 9 o'clock and I just do what I'm told, um, that it's not that easy. The nurse practitioner's license is on the line. If the nurse practitioner is just told what to do, doesn't even know why they're recommending it, they're just being told, recommend this, recommend that, do that, and there's an audit, there's an investigation, there's a malpractice case, the nurse practitioner is going down with the office. You see, it's not that simple. This is a serious matter. You're treating patients. Every service that you recommend, the nurse practitioner needs to know why it's being done, the clinical rationale, and when to stop doing it. So we have all these services, and the nurse practitioner should know what constitutes a unit. 8 to 22 minutes is 1 unit. 23 to 37 is 2 units. Nurse practitioner, yeah, this is another challenge. Many nurse practitioners, at least the ones that I deal with, they come from facilities where they don't even have to come up with a diagnosis. The office manager is coming up with the diagnosis, or the medical doctor is coming up with the diagnosis. Well, guess what? In your facility, the nurse practitioner needs to come up with the diagnosis. Does the nurse practitioner know how to diagnose radiculopathy? What's required in the notes in order to justify what orthopedic neurological tests should be done to justify radiculopathy? These are the things we teach the nurse practitioners. Does your nurse practitioner know the difference between a disc disorder and a disc displacement? How about disc degeneration? Does your nurse practitioner have any experience with trauma? If you see a lot of PI patients, when you're interviewing a nurse practitioner, that would be a really good question. Do you know how to deal with trauma, sprains, strains, fractures, concussions, traumatic brain injury? If that's a big part of your practice, PI, dealing with attorneys, you should try and get a nurse practitioner that knows how to diagnose these and be able to justify them in a court of law. Headaches, pain and symptom codes, complicating factors, comorbidities. Make sure your nurse practitioner knows all these things. More services, yeah, these are the ones that probably a lot of you want to know about. The nurse practitioner doing trigger point injections, absolutely. This is probably the most common service nurse practitioners do in a chiropractic multi-specialty practice setting. So here's the information on trigger point injections, detailed information here. There are the codes. Here, this is Aetna's policy on joint injections. The nurse practitioner needs to read this. You see, this is the way we train our doctors. Get the nurse practitioner, if you're going to see Aetna patients and the nurse practitioner is going to be doing the trigger point injections, get the nurse practitioner to read Aetna's policy on trigger point injections. Get the nurse practitioner to read it. Read all the policies, and then you should have the nurse practitioner sign a document stating that they understand the office policies and procedures and they'll abide by them. And if they don't, it could be grounds for termination. So, this is serious stuff. You want to make sure your nurse practitioner knows what to do, why to do them. So get your nurse practitioner to read the policies on trigger point injections. Here's the information on joint injections, also very common. The most common one I see is, that 20611 knee injections, small, large joint. You could do all types of joint injections with your nurse practitioner. Make sure they read the policies from the insurance companies on joint injections. Back braces, TENS machines, home traction. These are all things your nurse practitioner can bill for, evaluate for, treat patients. It really opens up a whole nother approach to healthcare and getting paid and running your business. You want your nurse practitioner involved with NCVs and EMGs? Why not? Here are the NCV codes. They've changed over the years. Here's the policy. This is right from Medicare. So if you're, a lot of my clients, when they bring on a nurse practitioner, much of the services are being billed to Medicare. Well, I have some clients in Maryland, in Florida, in New Jersey, where the nurse practitioner is basically just seeing Medicare patients for joint injections, for NCVs, for physical therapy. So make sure you learn the policies. This is right from Medicare. Needle EMG, sure, your nurse practitioner could oversee. You could have a technician come in, but if you're going to be billing out, right, it comes down to whose name is on the claim. You're billing out with the nurse practitioner's name on the claim for an EMG. Then, and it's a Cigna patient, make sure your nurse practitioner reads Cigna's policy. It's about compliance. How about nutritional consultations? You think your nurse practitioner might do nutritional consultations? Great. Fantastic. Here are the nutritional consultation codes. 97802 is the initial, 803 reassessment, 804 in a group setting. What else can your nurse practitioner do? I got them all right here. Stem cell, PRPs, hormone injections, biofeedback. We have some of our clients that have hired nurse practitioners to do EEGs, vestibular testing, Dopplers. I did Doppler studies in my multi-specialty practice. We were very close to getting a hyperbaric oxygen chamber, but we just didn't have room and it got a little bit too hectic. But yeah, some clients doing hyperbaric oxygen, weight loss. So these, I think I covered just about every possible service done by a nurse practitioner in a chiropractic multi-specialty setting. Now back to compliance. The bigger you get, the more protection you need. The more, well, I'll pass on that. Medicare, OIG compliance. What I was going to say is the more patients you see, the more income you're getting from insurance companies, the more protection you need. So the bigger your house, the more homeowners insurance you need. The more kids you have, the more health insurance you need for your kids, right? So Medicare, if your nurse practitioner is going to be billing Medicare for any type of service, Medicare requires that you have a billing and coding OIG policy manual. Basic policies like doing internal record reviews and documenting your staff trainings and going to the OIG exclusions list to make sure the nurse practitioner and your billing company hasn't been excluded from the Medicare program. And the other thing, what's your policy on collecting deductibles, copays, and car insurance? Do you know about the Stark and anti-kickback laws? Make sure your nurse practitioner doesn't own another facility. There could be a problem there. So an anti-kickback, you shouldn't be paying per patient. Free exams, you have a policy on free exams. This should all be put into your billing and coding policy manual. You have a policy on waiving copays and deductibles, free exams. You have a policy on discounts. You want to give a patient a discount? What's your policy on that? They're going to see, I just recently had a client say, Dr. Kotler, we have a patient that while they were under insurance, we were doing trigger point injections. And now that the insurance is over, the case is over, this patient still wants to come in and get trigger point injections and pay cash. How much do we charge? Huh? Can you take off 20%, 50%, 60%? Was this patient being billed in network, out of network? There's a lot of things that go into that. And there's so many more things I'd like to talk about. This nurse practitioner webinar, 30 minutes is just not enough. So just a few closing comments. Get proactive. Don't wait for the oil light to flash on your dashboard. Get out of the car, open up the hood, check the oil, make sure all the forms get signed. Staff member, step 2, that's for you. Doctor, step 3, that's for you. Make sure you review all the paperwork. Make sure your nurse practitioner reads all the forms that the patient fills out before the nurse practitioner goes in and sees the patient. Number 4, review the policies. Of course. How do you know what to bill if you don't read the policy from the insurance company? If you get audited, they use that policy against you. So you use it for your advantage. That's what some of my most successful clients, I have a client, what he does is he takes the insurance company's policy and he works backwards. He memorizes and he treats the patient based on the insurance company's medical policy, where it says when they should be done, how many should be done, where they should be done, what's considered medically necessary, who can provide the services. He builds his care plans based on the medical policies and the LCDs for Medicare. And guess what? He never has a problem. He's been audited he has a huge practice. So he gets audited. The bigger you are, the more chance you're going to get audited. That's okay. This is, that's the way it goes. I had a client last year. He collected $700,000 from Cigna. One doctor collected $700,000 from Cigna. Do you think they're looking at him? Yes. Do they audit him? Of course. Every 6 to 9 months, he gets a request for records. Sometimes they find a few things. Most of the time, they don't. But you want to protect yourself. Understand the what and the why. What you're doing are your CPD codes. Why you're doing them are your diagnosis codes. They have to match and pair. Do a self-test on your notes. Always keep learning. Step 7. Step 8, you should definitely have a billing and coding policy manual for your staff. Your staff need to know that you are doing things right. You work in a compliant culture of compliance is always there. You have an open door policy. You want to make sure your staff are comfortable and happy. Why? Because a disgruntled staff member could report you to the board or to the insurance company. I see it happen. It happens every 3-4 months. We get a call, doctor's in trouble. Conduct regular meetings, of course. You want to do this so you could swan. You want to do all these things so you could swan. You know what that means, swan? Sleep well at night. It's my favorite acronym. All right, so I just want to thank everybody for attending. We're just about done. We're going to get to questions in a few minutes. Here's my contact information, Dr. Kotler at targetcoding.com, website, telephone number. We offer free 15-minute consultations. If you're thinking about bringing on a nurse practitioner, contact us, email us, request a free 15-minute consultation just to talk about your situation. You have specific questions, you already have a nurse practitioner in your practice and you're doing something and you're not getting paid, set up a 15-minute consultation, free. So we're going to get to questions and answers. Yeah, we do billing and coding compliance manuals, Medicare compliance manuals. We put together for doctors HIPAA compliance manuals. Besides compliance manuals and doing these webinars, we also do seminars. We do on-site trainings. We have membership programs. Many of our seminars are CE approved and webinars. We also have a chiropractic compliance program, which consists of HIPAA, OIG, and OSHA. Do you get HIPAA headaches? Do you have OIG procrastination? Do you have OSHA indigestion? Outsource your compliance program to us. This is mandatory. Yes. If you don't believe me, Google. If you're in Kansas, Google. Does Kansas require compliance for chiropractors? If you're in California or New Jersey, check with your state board. Google it. Is OSHA and OIG and HIPAA required? You will see it's required in every state. So just do it. Get it over with. You'll feel, it's like, I look at this like going to the gym. I don't like going to the gym. I dread it. But after I'm done, I am the happiest guy in the world. With HIPAA and OSHA and OIG, it's not fun thinking about doing it, but once you're done, you could relax. We do all the heavy lifting. It's $199 a month. If you want to prepay, you could save a few dollars. It doesn't take a year. We just stretch it out over a year to make it easier for most doctors. $199 a month for 12 months. If you want to prepay, that's fine. It's 1 year of support, but it takes about 3 months to go through the program, and then the rest is maintenance. So 3 months or so, acute care, and then the rest of the year is maintenance. We're going to have you do things once a month or once every couple of months. We're going to check on you. It's only $199. That's the Target Coding Chiropractic Compliance Program. How about ASH? I know most of you listening to this are affected by ASH. ASH is a large corporation. It's the largest chiropractic management company in the country. They have over 30,000 in-network providers. Many of you, or just about maybe all of you listening to this, are impacted by ASH. So we have put together a ASH live training. Just us and your office. You pick the day, you pick the time. It takes about 90 minutes, and we'll go through everything you need to know about ASH. How to get paid out of network, how to get more money in network, how to get more visits in network, how to get more visits out of network, how to appeal, how to fill out the medical necessity review forms. Oh, we're doing a seminar on a cruise ship coming up. Want to come with us? We did one last year. We loved it. So this is our second annual Target Coding Cruise. 10 credits are approved. Also, we got approval for acupuncturist. We got 6 PDA points approved for acupuncture. It's on the largest cruise ship in the world, the Symphony of the Seas. It's coming up in April. Hope you can come. Here's the book I was referring to on the best chiropractic ICD-10 and CPT codes to improve reimbursement. It's our best-selling book. It shows you how to code pair. Yeah, I consider myself a coding sommelier. I'll pair your CPT and ICD-10 codes perfectly, just like a wine and food master. What else do we do here at Target Coding? Oh, sometimes we get doctors saying, Marty, we just need a soap note checkup. Could you just check our notes? Of course, we could do that. Bring your soap notes in for a checkup. We'll review your notes, 5 charts, and we'll review your fees. We'll do a complete, thorough fee schedule review. We'll help you get proactive to avoid audits. We'll help you find money you're leaving on the table. How do we know? You know that farmer's insurance? We know a thing or two because we've seen a thing or two. Same thing here at Target Coding. We've been doing this for 12 years. We've helped doctors add 1 CPT code, and it in turn equaled an additional $10,000 of extra income. We've done that many times over the years. So we have a comprehensive chart audit and fee schedule review. This might interest you. How about just videos? You just want to buy a few videos? Here, we have 11 videos available for sale on the Target Coding website. You want to become a member? Here, our basic membership, $99 a month, pay as you go, no contract. You need forms? We have the best forms in the industry. New patient forms, financial and admin forms, even if you have the best software in the world. You got ChiroTouch, you got Eclipse, you got ACOM, don't matter. You still need forms, and you can copy and paste these forms and put them into your software. Do you have a form on how to push back on your denials? Do you have a form on how to get patients to bring in the checks because it's going to them, right? If you're out of network, the checks go to the patient. You have a letter of medical necessity for orthotics, for pillows. I just had a doctor. He needed a letter of medical necessity for a mattress for a patient. The patient said the insurance company or the patient's employer would reimburse the patient for the mattress. Just need a letter of medical necessity. Got tons of those, tons of sample soap notes. All right. So again, I want to thank everybody for attending. Here's my contact information. Let's go and take a look and see what questions have come in.